Greetings to the audience of the Journal of Human Nutrition and Dietetics. My name is Giana Blaauw, and I'm the principal researcher and corresponding author of the paper titled Caregivers' Nutrition-Related Knowledge, Perceptions, Practices, and Barriers Regarding the Therapeutic Diet for Classical Galactosaemia. I would like to formally acknowledge the co-authors of this paper, Professor Yvette van Niekerk, the study supervisor, and Professor Robin Dolman McLeod, the co-supervisor for the study. Classical galactosaemia is a life-threatening inherited metabolic disorder of galactose metabolism that usually presents during infancy and is treated with a galactose-restricted diet. It is the most common disorder of carbohydrate metabolism worldwide and is of particular relevance in the UK setting, where the incidence rate is higher than that of global estimates. Living with galactosaemia and adherence to a lifelong restricted diet can be burdensome to patients and their families, and it can impact on their quality of life. However, little is known about caregivers' experiences of overseeing the diet for their child with galactosaemia. Galactosaemia also remains one of the only infant diseases that is a true or absolute contraindication to breastfeeding, and little evidence exists on the parental views of being unable to provide breast milk to their child within the context of conflicting universal public health messages that promote breastfeeding practices. Although some studies have explored the quality of life of individuals with classical galactosaemia, none have explored the impact of the therapeutic diet on caregivers of infants and children with the disease, and this study aimed to address this gap. Using a quantitative cross-sectional study design, we conducted an online survey among 98 eligible members of the Galactosaemia Support Group charity using a novel questionnaire developed by the researchers. The Metabolic Support UK charity also advertised the survey on their official social media platforms and via direct email to eligible members as a supplementary recruitment method. A total of 43 caregivers participated in the study. 93% of caregivers felt that galactosaemia patient associations were helpful when managing the diet for their child. 75% of caregivers reported that their primary source of information about the diet was obtained from a galactosaemia patient association, such as the Galactosaemia Support Group, followed by 21% who obtained dietary information from their child's dietitian. 98% of caregivers were considered to have high levels of knowledge about the galactosaemia diet, and their knowledge scores were found to be positively correlated with their education level. 65% of caregivers had high attitudinal scores, revealing that they had an overall positive attitude towards the galactosaemia diet. However, 49% of caregivers had a negative perception about being unable to feed their child breast milk at birth, and this perception was found to be significantly associated with caregivers' intentions to feed their child breast milk. Concerns about the safety of their child in social settings was a barrier for 79% of caregivers, while 47% felt that their child was excluded in social settings because of following the galactosaemia diet. These results not only provide insights into caregivers' knowledge of the diet and related practices, but also help healthcare professionals to understand the parental perspective and barriers to dietary compliance, thereby informing future clinical practice. This study also raises awareness of important diet-related considerations for treating healthcare professionals to address with caregivers of children with galactosaemia. As caregivers mostly had a high level of knowledge and self-perceived confidence related to managing the galactosaemia diet, the focus of healthcare interventions should be on exploring the negative perceptions and unique barriers caregivers experience towards compliance with the diet in order to provide tailored support and facilitate lifelong dietary compliance. Furthermore, mental health awareness and psychological support should form an essential element of care to caregivers by the specialist multidisciplinary team. The take-home message from this paper is that the galactose-restricted diet remains the primary treatment for classical galactosaemia, and exploring care